This procedure will teach you how to aid the provider in the examination of a patient by preparing the patient and the necessary equipment, and ensuring the patient's safety and comfort during the examination. Check the examination room at the beginning of each day and between patients to make sure it is completely stocked with the proper equipment and supplies, and that the equipment functions properly. Check expiration dates on all packages and supplies regularly and discard expired materials. Sanitize your hands. Prepare the exam room before and between patients according to acceptable medical rules of asepsis. Set out the instruments for the procedure in order of use within reach of the provider and cover them until the provider enters the examination room. Greet and introduce yourself to the patient.
Hi, Andrew. I'm Julie, Dr. Anderson's medical assistant.
Good afternoon, Julie.
Could I just have you confirm your full name and date of birth?
Yeah, sure. Andrew Woodard.
Then confirm the patient's identity using his name and date of birth. Explain the procedure to be performed in a manner that is understood by the patient. Answer any questions the patient may have about the procedure. Refer any unanswered questions to the provider.
That's great. So you're here to see Dr. Anderson for your annual exam, and I'm going to be assisting her by taking some vital signs and some other measurements. And so that's going to include your pulse, we're going to get your blood pressure, we're going to get your height and weight as well, and then we'll be coming back into the exam room and she'll be completing that exam for you.
Okay.
Do you have any other questions for me?
Review the patient's medical history with him and investigate the purpose of the visit.
I do want to review a little bit of your history, though. And what were you in for previously?
Well, Dr. Anderson scheduled a 6-month checkup. She was concerned about me maybe after the last time I came in because of the asthma attack.
Okay. Have you had any asthma attacks since then?
No.
Okay. And are you still taking the albuterol?
Every once in a while.
Okay, great.
Review current medications and document any changes or prescription refills needed. Document the interview results. Measure and record the patient's blood pressure, height, weight, and body mass index, BMI. Instruct the patient on how to collect a urine specimen, if ordered, and hand the patient a properly labeled specimen container.
So this is for collecting a urine specimen. I'm going to have you take it down the hall to the bathroom, and you can just leave the specimen there when you're done.
Alrighty.
Give the patient a gown and drape and explain what clothing should be removed for the examination.
So Dr. Anderson needs you to get completely undressed and put this gown on with the opening down the back. And then when you're done with that, you can have a seat on the end of the table and place this drape across your lap.
Tell the patient whether the gown should open in the front or back. Help the patient with undressing as needed, though most patients prefer to undress in privacy. Give the patient privacy while changing. Knock on the examination room door before re-entering to make sure the patient has completed undressing and gowning. If the patient is elderly, confused, or feeling faint or dizzy, do not leave him or her alone.
Come in.
How are you feeling?
Pretty good, all things considered.
Good. No faintness or dizziness?
No.
Place the patient's paper health record in the designated area, or make sure the computer is ready for the provider to log in and access the patient's electronic health record, or EHR. Be careful to safeguard patient confidentiality, especially when using paper records. Assist during the examination by handing the provider instruments if needed.
Okay. Julie, I'd like to get a blood test to see how his cholesterol levels are. So
Okay.
could you take care of that?
Sure.
Thank you. Thank you, Mr. Woodard.
Then help him from the table. Use proper body mechanics if assistance in transfer is needed. Ask the patient if he has any questions.
So it looks like we're all done here. How are you feeling?
I'm all right.
Okay. I'm going to go ahead and have you get dressed, and then we'll go down and get that blood work taken care of.
Assist with dressing if necessary.
Mr. Woodard, do you have any questions for me?
Yeah. Do you think like this high blood pressure or the high cholesterol will have an effect on me throughout my whole life, or?
You know, that's really a little hard to answer, and Dr. Anderson's going to want to monitor your blood pressure over time and see how that goes.
Give the patient any final instructions and schedule tests as ordered by the provider and/or the next appointment.
All right.
All right. Well, let's go get your blood drawn.
All right.
Okay.
Obtain any blood samples. Once the patient has left the exam room, put on a pair of disposable gloves. Dispose of used examination table paper according to facility policies. To prevent the transmission of pathogens from one patient to another, use disinfectant wipes to clean the exam table, all instruments, and any potentially contaminated surfaces. Then dispose of your used gloves. Once the exam table is dry, pull clean paper over it. When you're finished, sanitize your hands. Replace used supplies and prepare the room for the next patient.